People with ADHD can actually really hone in on the areas of life that interest them. And that can be very powerful, actually.
Hi, Shai.
Hi, Fearne.
Shai, how might ADHD affect someone's life?
ADHD might affect someone's life in a whole range of ways. One of the things that we're seeing is that it affects people emotionally. People with ADHD, if left untreated, can go on to develop chronic anxiety and depression, and it can also affect sleep as well. So people think of ADHD as, well, attention deficit, so you're not thinking of anything at all. It's actually the complete opposite. I've had patients describe having 100 TV screens on at the same time and they can't find the remote. So if you have that going on in your head, how do you switch all that off and go to sleep?
Yeah, I mean, how do you? How do you treat ADHD? I know there are many different routes you can go down, but I'd love to know a few of those options, and also how someone might go about seeking help if this is resonating, or if they perhaps want a diagnosis.
Sure. So, well, the first thing I would say is you want to speak to a medical expert that has expertise in diagnosing and managing ADHD. So the first step that you might do is you might go to your GP and explain some of your symptoms. They can ask you to fill out screening checklists which might indicate whether, okay, this is looking like ADHD and maybe I should seek some help, and they can refer you. Or you can seek a psychiatrist independently as well, without a GP referral. Broadly speaking, there are 3 arms of treatment. The first one being medication. Now that could be very scary for some people if you've never taken any regular medications your whole life. For other patients who'll come to see me, they'll say, well, they've tried a string of antidepressants, none of them have really worked, and they're still constantly feeling anxious and depressed. These are red flags where you have to think as a professional, can something else be going on that's causing this? Because many people with ADHD will develop anxiety and depression and they're on the wrong medication. I'm not taking anything away from antidepressants, they have their use, but you've got to treat the right thing.
Yeah.
The other arm of treatment, which I would say goes alongside medication, are talking therapies, things like ADHD coaching. An ADHD coach is almost like a personal trainer for your brain. So they give you strategies to help with your organization, with starting tasks, seeing them through to the end, and they keep checking up on you. And then the final thing are lifestyle factors. Exercise is shown to significantly improve ADHD symptoms. And all the science is showing that, and patients say that themselves as well.
And so how is that working on a physical level? If you are going out and having a run or doing a dance class, whatever it is, how is that affecting your ADHD, your emotional processing? How is that working?
So if we look at the chemistry of ADHD, there are a couple of chemicals that are at lower levels in the brain and the nervous system. So low dopamine and low noradrenaline. Now noradrenaline breaks down in your system to become adrenaline. When you're running, you're releasing lots of these chemicals. Dopamine is part of the reward pathway, what's quote unquote called the feel-good hormone, one of the feel-good hormones. So when you're running, you're releasing these chemicals naturally. And that's what's over time building up in your system and helping with your symptoms.
So it's okay to seek out dopamine, but you've got to have the infrastructures to do it in a healthy way, essentially, and that's what right. A coach could provide you.
That's exactly correct, yeah.
We can get stuck on talking about ADHD in a way that feels quite heavy and scary. And yes, there is a serious side and there's solutions in place, but there are real positives. There are real moments of superpower with ADHD, and I'd love to talk to you a bit more about that.
Absolutely. So in my line of work, I've seen many people use their ADHD in such positive ways and be extremely successful. Some people have used their hyperactivity symptoms and have developed very successful careers as athletes or sports, go into the sports field. Some people are extremely creative.
Yes.
So they've developed very successful businesses of their own, creative in the performing arts. Also, there's this concept of hyperfocus, which we see in ADHD, which you may or may not have heard of. I'm sure many people watching this probably have heard of this as well. People with ADHD can actually really hone in on the areas of life that interest them, and that can be very powerful, actually. So they can spend endless amount of time, almost, on areas of passion. And if that's in line with your line of work, that can be extremely
incredible. I think that's so empowering for people to hear that are either newly diagnosed or that are living with ADHD, that there are these incredible moments where you can really use that hyper-focus to hone your skill and to achieve brilliant things. I think that's so cool to focus on that.
Yeah.
So does ADHD affect men and women in different ways? Can it differ in the presentation and the feelings and the symptoms that they have?
Absolutely. So there's a growing body of research which shows in women, ADHD symptoms might correlate with the menstrual cycle and for the female sex hormones. So during parts of your menstrual cycle, in the days leading up to menstruation or before your periods, one of the sex hormones, estrogen, lowers in order for you to menstruate. When that lowers, you get a further lowering of dopamine, noradrenaline, and other chemicals like serotonin. People will experience an exacerbation or a worsening of their symptoms. Now, you progress that through the timeline towards menopause. During menopause, you're in a constant state of low estrogen. So all of that worsens. So everything becomes more and more of a struggle. And we'll often hear women saying, you know, I could cope with these things before, but now I can't cope anymore. Because they describe it as a wall they're having to climb so much higher and higher to get things done. And that's physically, mentally, and emotionally just draining.
Yeah, I mean, it makes so much sense because I think we've heard recently there are way more cases of women having that later diagnosis because they've hit menopause or they're struggling with their menstrual cycle, and that has led to a diagnosis. And also I know from what I've tried to learn myself about ADHD that girls are often missed as kids, as schools, because they have an inattentive presentation rather than a hyperactive one. So they're seen as daydreamers, or their thoughts are just kind of drifting about. But actually, it's ADHD, but it's just presented, it's probably more visible in a young boy because they're typically hyperactive, running around, jumping, but the girls aren't showing that presentation.
Absolutely, and actually, many of them were very well behaved. So their school reports will show they were a really good kid, but they're not meeting their potential. They just need to try a little bit harder. Actually, as adults, I see these people and they were like, well, I was actually trying really, really hard.
Yeah.
And I could never understand why it was so much harder for me compared to everyone else.
Yeah, absolutely. I mean, the whole thing, it seems like ADHD is just talked about a hell of a lot more, which is a positive. You know, the more people that have an understanding of the inner workings of their brain, the better, so that they can find solutions and find some peace moving through life. Why is that? Because these things tend to have the potential to be like a trend thing, like, oh, I must have ADHD, and it becomes a bit of a reductive, fashionable fad. But this is actually, as you've stated, very serious, and it can be treated. It's not the end of the world. There are absolutely solutions in place. But why is it being talked about so much more?
Well, look, I think quite helpfully, certain celebrities, etc., have come out in the media about their diagnosis. That raises awareness immediately. There's a lot of awareness out there on social media in general, where I've seen many videos about patients talking about their symptoms, and then people have come to see me saying, well, you know, I saw this video on TikTok, and that was exactly me. So I think general media is creating mental health awareness at large, right? I think as doctors, we're starting to realise more and more that this is persisting beyond childhood. It doesn't go away on your 18th birthday, right? So, and we're also seeing the impact it's having on people emotionally. So I've had many patients come to me in clinic who have said, do you know, I've been depressed or I've been anxious for as long as I can remember. I've had 20 odd years of antidepressants, and it kind of helps somewhat, but not really. When you hear that, and I say this to GPs out there, well, if you hear that, that should raise a red flag. I'm not saying it's always ADHD, but there might be something else going on that's causing that outward presentation, and you've got to look at that thing that's causing the outward presentation, not just trying to put a plaster on the symptoms.
Yeah, absolutely, because if that medication isn't working, then something else clearly needs to be done. If you're on antidepressants and you're not feeling the benefits, then it's worth exploring what might be sitting underneath that. Shai, thank you so much.
Thanks, Fearne.
If this conversation has resonated, if you've got something to say, if you want to learn more, then do leave a comment below. And if you enjoyed watching this and you enjoyed learning about this subject matter, do click subscribe for more. Shai, thank you so much.
Thank you.